Welcome back to the Personal Care Assistant Certification course. In this module, you'll learn what a PCA does, who qualifies, where they work, and how the certification and exam process work. This lesson is key. It explains how to get certified and what to expect on the test, helping you prepare for success. What is PCA certification? PCA certification is an official recognition that confirms you have the knowledge, skills, and training needed to provide basic personal care to clients, particularly elderly or disabled individuals. Why PCA certification matters? It is required by many employers. It demonstrates competency in personal care skills. It ensures compliance with state and federal regulations. It increases job opportunities and trust from families. Certification requirements may vary by state, but most follow similar core guidelines. This course prepares you for the general PCA certification exam that applies in most states. Eligibility requirements for PCA certification. You typically qualify to take the PCA exam if you meet the following requirements. Are at least 18 years old. Can pass a criminal background check. Provide proof of a high school diploma or GED. May be waived in some cases. Complete a state-approved PCA training program. Have documentation of TB testing or medical clearance. These qualifications ensure you're ready and eligible to provide safe, competent care as a certified PCA. Let's have an overview of the PCA exam format. The PCA exam tests your knowledge across core caregiving areas. Here's how it's typically structured. Written or knowledge-based exam. Usually, the format is multiple-choice questions, length 60 to 80 questions, depending on the state. Time, usually 90 minutes. Passing score, around 70%, varies by location. Topics include infection control, communication skills, personal care procedures, emergency response, patient rights, ethics and professionalism. In addition, you may be required to demonstrate key skills such as proper hand washing, transferring a client safely, taking vital signs, dressing a client. Remember that you'll be graded using a standardized skills checklist. Practical skills testing requirements vary by state. Please consult your state regulatory agency or PCA training provider to verify the specific requirements applicable in your jurisdiction. How the test is scored. Each section of the test is scored independently. In many cases, you must pass the written portion to become certified. Failing one section may require a retake, usually after a short waiting period. You may get your score immediately or within a few days, depending on the testing center. Example question types you might see. What is the most effective way to prevent the spread of infection? A. Wear gloves only when necessary. B. Use hand sanitizer after meals. C. Wash hands before and after patient contact. D. Change clothes twice a day. The correct answer is letter C, wash hands before and after patient contact. Another sample question. Which of the following best protects a resident's dignity? A. Turning on bright lights during personal care. B. Discussing their medical issues with others. C. Keeping them covered while bathing. D. Rushing them through tasks. The correct answer is letter C, keeping them covered while bathing. Here are tips for success in preparing for the certification exam. Focus on real-world scenarios. Many test questions are situational. Master the basic procedures like hygiene, ambulation, and feeding. Understand your role boundaries, what a PCA can and cannot do. Be familiar with patient rights and confidentiality laws, like HIPAA. On the test, they may ask questions like, which of the following would be out of scope for a PCA? Or, which federal law protects patient privacy? Quick recap. Key points to remember. The purpose of PCA certification and why it's required, the basic eligibility requirements to take the exam, the format of the test including knowledge-based and possibly skills sections, what content is tested and the types of questions you might face, how to prepare effectively by focusing on real-life duties, legal standards, and patient care skills. Mastering this information will ensure you're fully prepared when you sit for your PCA certification exam.